people don't feel comfortable being recorded, please do let us know, or turn your camera off. Thanks, everyone. So first of all, just a quick summary of the last meeting, which unfortunately I couldn't make, but as I understand, Owen very skillfully chaired it. So Daisy, could you just give us a quick summary of what happened and what the themes were?
Yeah, definitely. I don't think we'll do as good a job as you, Owen, today, but we will try. So yeah, I mean, mainly we had a session that Karen actually ran on the emerging mental health data, so that was really good. And then we had a good discussion as well, because Owen kept us so well to time, about what we wanted to hear about at this meeting. So we've actually we're going to have a discussion later on at the main part of the session about a topic that sort of or topics that came up as something that people would find useful. So yeah, it was really helpful to have that input, and we'll try and do that again today in terms of what people would like to be hearing and having the chance to talk about. So in terms of updates this week, I sent an email on Tuesday, as I always do, with some sort of useful updates, hopefully useful. So key messages, key COVID messages. Obviously the guidance is changing and is probably going to change again, and you know, but this is sort of reinforcing what we should sort of be encouraging people to do with generally, without having to go into the sort of nuances of the guidance. There's also a scheme that was just launched in Leeds this week to support those who've been asked to self-isolate. So that's about helping people financially to isolate if they have to, and obviously encourage them to do that. So that's on there. There's some updates from 100% Digital. So they've been doing some webinars. I think they passed, I think they were yesterday. And they were also looking to work with people that are delivering in the Hatch LCP area, I think it is. So there's more information there. So yeah, those are just some of the key things. And I'll pass over to Carl.
Brilliant, thanks Daisy. So the next thing on the agenda is a little bit about the winter planning workshops, which I know some of you have been very present at. So thank you so much for attending those. So the winter planning sessions have been delivered within each of the local care partnerships. And they're really there to help join up some assets within communities to meet the challenges of winter. So there have been 11 of the 12 which have taken place so far, all really positive, all really different. And I don't know if it's helpful to get some feedback from those who were present in those sessions. I know Rachel, Toshal, Ali, you've all been present, so don't want to put you on the spot, but if you do have any feedback, it'd be really useful to know your thoughts on how they've gone.
Yeah, I've been to 3 or 4 now, and they have all been very different. I think it's quite good to have that local knowledge and that local sort of on the ground barriers that maybe that people are working through. So I found it incredibly helpful, and I've learned a lot as well. So especially with Toshal and the Health for All and the stuff that you're doing in South Leeds, I didn't realise to that extent the support that's out there. So I've fed that back to the team. So it's really great to kind of gather all that information and share it back. So I found them all really helpful, and it's also helped me put carers on the agenda as a group that's particularly isolated at the moment. So yeah, that's all good. I encourage everyone to try it, go to one.
Brilliant, thanks Rachel. Wendy, I think you've also been at some workshops as well, so yeah, any feedback that you have would be really valuable. There is only one remaining, which is the Hatch area workshop, which covers Hills, Bermontoft, Richmond Hill and Chapeltown. So that's happening on the 20th of October at 3 p.m. So if any of you work within that LCP area, I'd really encourage you to sign up and attend that. Ali.
I'm going to that one.
Brilliant. Yeah. Excellent. And Damien, did I see your hand up as well?
think he's just
No, I
saying
thought I
hi.
was waving. I thought I was waving back to Karen. I thought she waved, so I waved back. It's like being in an auction room, isn't it? You have to be careful.
What are you going to
Sorry.
buy, Damien? Thanks, everybody. So yeah, we will be feeding back more broadly around how those workshops have gone, and each of the LCP areas is developing a winter action plan. So there's going to be ongoing conversations within the LCPs around that piece of work. And yeah, fingers crossed, it will be a really tangible example of how the LCPs can work together and the system can come together to meet the challenges of winter. Brilliant. So if we could then move on to the next point in the agenda, which is updates from each of the organisations. So just bearing in mind time, if we could just keep it to a couple of minutes each, covering some of the most pertinent priorities for each organisation, that would be super helpful. And I'm going to cherry pick if that's okay. So top of my screen, we've got Simon. So are you okay to give an update from your perspective, please?
Yeah, from the perspective of Leeds Faith Forum and the faith sector. So I think one of the concerns we have at the moment is in terms of the possibility that there might be this circuit break of 2 or 3 weeks, and the effect that it might have on places of worship in terms of, are those going to have to shut for 2 to 3 weeks? And obviously we know the powerful mental well-being effect of places of worship. We're just a bit worried about that, and obviously from the point of view of those being of networking. The other thing that we are working on in conjunction with the council is a faith covenant, which is going to set out a series of commitments that the council will do to actually work within assist faith communities. And there'll probably be something in there which relates to health and well-being and public health, and continuing to work with the council in terms of the response to COVID. I think those are the main things. The other thing just to mention is in a couple of weeks, we're going to be working with an organisation down in London, or 2 organisations down in London, Women's Interfaith Network and Faith Forum for London, and it's going to be a week of action around domestic abuse and focusing on how faith communities can stand up against domestic abuse, and possibly looking at, the current links between lockdown and the rise in domestic violence, which has been highlighted in a range of reports, but this is going to be a week which really tries to mobilise faith communities.
That's excellent. Thank you, Simon. If anybody has any questions for Simon or any of the other people giving updates, please do put it in the chat, and then we can come back to those at the end of this section. So, Shell, can I move on to you, please?
Hi, everyone, and just wanted to, in terms of Health for All, I'll give you some good news. We had some funding from the COVID infrastructure grants from Leeds Community Foundation to support BME elders with getting online. So basically a BME seniors network that was funded in 2015 by Time to Shine work was to support older volunteers from different BME communities to run volunteer run groups, which is the model most of Health for All's groups run on. So we sort of initially set a small group up, and then gradually, as some sort of local volunteers or capacities build within that group, they take the ownership running of the group. So we had around 7 volunteer run groups under the BME Seniors Network, and 2 of them have gradually been able to get online to run their activities because they were getting quite frustrated, worried, anxious about what they can do, they can't do. But then there are other groups who just haven't got the capacity. So we've got 7 hours of a staff time to be able to support individually those volunteers to set computer up, have some tablets, and trial some online sessions, because we know, it will be in long term, winter coming, many of them anyway struggle to get to the groups without transport. So yeah, that's good news. Apart from that, regards to all our work with older people, specifically with the Chinese community as well, we had restarted our weekly group at Beeston Village Community Centre in September. And just last week, I think older people who were coming got again quite worried and anxious because of the information out there. And so they've decided to not come, but we are going to do home deliveries. So they'll be getting their once a week food at home, which we had 12 already kind of requested, because we've only got capacity of doing 15. So that's in older sort of Chinese members. And generally, because we have the community centres, we have been able to offer people space to come back safely if they wanted to. So there are some small groups restarted within our community centres, and online groups have been, again, I think before, even staff or volunteers who were not or members themselves who were not keen on having the virtual groups, you can see that that's kind of changing a bit. So I think that's a good sort of, in terms of digital world. And listening at the LCP last week about digital access, it's, fingers crossed we'll be able to do some more work around that. I don't know, Carl, if you wanted me to update on the digital side of things, that might also, could it be part of this? Because we've got some funding to set up digital access within our centres. So we are going to try and get into sort of one-to-one sessions booked where older people can come in, because I think many of them are still conscious of home visits and not very are worried about it, and we don't want to put older people at risk. So we're going to set pop-in sort of sessions on one-to-one within the centres, if there's an uptake for that, to try and support them. Because during lockdown we did have some iPads from 100% digital, but with older people, what the struggle was, because we were not prepared for this, I think, to sit down with somebody and go through, we needed that close contact, which we were not able to offer during lockdown. So yeah, that's the plan. Fingers crossed we'll be able to set that up by Christmas time, if we get our infrastructure ready in time to be able to offer that within the centres.
Great, thanks.
I think
so
that's
much
about
positive.
it.
Yeah, I mean, there's a whole load of positive news there, which is amazing. Thank you so much. And I see some comments within the chat asking for you to share some information. So yeah, if you could do that, that'd be great, Toshal. Thank you so much. Can I go to Karen now, please?
Thank you, Carl. So I'm here on behalf of three different, well, I think probably communities of interest. The Physical and Sensory Impairment Network goes across a few different ones, but I'll just give a brief update on behalf of learning disability, mental health, and the communities of interest that link with the Physical and Sensory Impairment Network. So the main thing to tell you from mental health perspective is that the report that we brought to this group last week has been finalised, so I'll share that with everybody. And thanks everyone for your additional insight and information into that. Really keen to have some comments, and really want to utilise this group as an ongoing mechanism for us to feed into the emerging mental health needs assessments and just general comments back through to the Mental Health Partnership Board. So I will share that for everybody to have a look at, and the comments welcome. From a long-term conditions point of view, just general concern, I suppose, that the longer this goes on, the less we're getting things like cancer screening and heart conditions being picked up. So I know some of the screening has restarted, so cervical screening being one of those, but some of our members from the Cancer Awareness Project and others dealing in similar long-term condition work, just struggling really to engage those messages with people and encourage people to take up screening. And I think it's linked with other things around you know, we've had the same sort of feedback from organisations supporting people with sensory impairments, just around not feeling that they're able to go for appointments or not going for them because they don't have the confidence to go into medical settings. So that's still ongoing. Yeah, so we had the PSI meeting this morning, so I'm just looking at my notes from that, but Wendy was there, so she'll probably give you her update from an AdvaNet perspective. But other things were just around people expecting this 2-week lockdown or whatever that might look like, so starting to build up their capacity again for thinking about food parcels, and particularly culturally appropriate ones, and support for the most sort of isolated older people or people who are vulnerable. And you know, thinking about how they're going to manage the increase in wellbeing calls that may be needed if we do go into stricter measures. From a learning disability point of view, we've had some feedback, and this was echoed across the PSI network as well, around transport. So having within some of the learning disability organisations, if they're accepting people face-to-face for groups, what they're doing is temperature checking when people arrive, and some organisations have fed back that, you know, they're not really sure what to do with the fact that if somebody's temperature then does seem to be high, they're then not going to necessarily be able to get back onto public transport after. So there's that whole difficulty that organisations are finding around what their role within that is, what their responsibility within that is, and then obviously the additional cost too that comes from that, and just additional need for resource and capacity and all that kind of thought process. I'm reading Jazzy's notes and trying to make sense of it, and also just around building space as well. So if we've had people members of staff within learning disability organisations that have had to self-isolate, what's the need then for the building to close? So just being really clear about what those restrictions are. And finally, one thing I missed from mental health, but does seem to be very important and pertinent, and also seems to be coming through in terms of demand, was from Leeds Mind. Gave us the feedback that they're getting they've seen an increase in demand from students phoning their reception, and also carers of students, or parents or people that are concerned about students. So not only is that something I think we're picking up on anecdotally, but we're also now seeing that as an increase in actual figures coming through to people. So hopefully that is enough of a whistle stop from those ones.
Kind of picking up on third sector worker morale, and that you know, like having been in this kind of second wave, that's particularly low. And I know the kind of counselling from Phoenix Wellbeing was quite well received and picked up really well. But I think, you know, kind of from a manager's point of view, it's you know, it takes a toll on all of us, and that there's some kind of conversations about encouraging people to kind of be resilient themselves. And I know that there's been previous mental health kind of resilience training provided in the past, and whether or not that could kind of be fed up somewhere, that would be quite timely. Seems to be from other organisations that the kind of provision is returning, but in a limited way. So that's more the kind of autism services where people might have a learning disability as well. And that it's although it's returning, it's still not meeting the need, and the demand's increased. Had a really positive chat with Nicola from Forum Central about carers, and she's linked me up with someone within the kind of CCG, and I'm linking in with Elaine, who runs our kind of parents of autistic people carers group, in terms of feeding back on some of the gaps and some of the increased demand there. So I'm sure that's no surprise to you, Rachel, that there's increased demand everywhere. We've relaunched our toolkit, so again, if anybody's got any autistic clients, there's lots of stuff in there, kind of new stuff, kind of COVID planning tools and communication profiles and social profiles, and kind of feedback, as always, is that mental health access is kind of not what it should be for autistic people. So we are doing lots of work with Leeds Mental Wellbeing Service and various aspects of kind of Leeds Mind and the NHS as well. I I was interested to hear about what you were saying about the provision you're providing, Toshal, in community centres, and it's something I probably should have mentioned to you, and I thought about earlier when you were talking about digital inclusion, is that obviously lots of people used to use libraries to access the internet, and it'd be great if there was an ask to kind of see if that provision could be extended to other groups of people who are excluded. But yeah, that's all from me.
Thanks, Owen, that's great. And now handing over to Rachel, please.
Hiya, thanks. Okay, so a couple of things to talk about this time. So we've noted an increase in professional contacts made on behalf of carers, which is really great that our message of identifying, acknowledging, supporting is really being put into practice. However, alongside that, we've noticed that not as many carers compared to this time last year are actually contacting us directly themselves. So even though it's fantastic that we've got that support from, or carers have got that support from other professionals, that's on our radar at the moment to worry why. And I don't know if that links in with also the issues around accessing respite. So there's capacity within respite services, but carers just aren't taking it up. Some of the feedback that we're getting is that there's an assumption that the services are closed, they're temporarily suspended, and no longer available to them. So I'm not sure if that's a message that needs to be reiterated, that things are open for business, but just maybe not in the usual manner. And then also feedback on respite is that the whole risk, it's such an increase in risk for them to accept someone else into their house or send the person that they're caring for to a respite service. So there's some barriers that we're overcoming, and I'm really interested to see how the discussions go this afternoon. The other thing that's really high on our agenda is care homes. The guidance, confusion, inconsistencies, the impact that it's having on the person in residential care and also the families. So again, I'll be really interested to see what comes out of the discussions this afternoon. But they're the three things that are really on our agenda at the moment. In the pipeline, we are working on our digital offer alongside some funding that we've got access to, but hopefully that'll be good news for next time. So I'll share that next time. That's it.
Brilliant, thanks, Rachel. Ali, can I move on to you, please?
Hi, I work with Leeds Neighbourhood Networks. So the neighbourhood networks, they were beginning to sort of step back into sort of more normalish looking services. But then with Leeds being put into the tier 2 category the other week, that then really threw them. And so there are issues around what kind of provision is the safest, with some neighbourhood networks deciding not to do anything in their spaces, but to continue to offer telephone befriending, and to continue to offer support to the most vulnerable. Some are doing doorstep visits, some have cut back on those. There are one or two who are still delivering stuff in their centres, and there are others who are just waiting to see how it goes. One of their big concerns with the impact of the tier 2 restrictions is that now we're coming into winter, they can't meet outside. They're saying that previously older people, particularly those who were shielding, knew that it was a definite 12 weeks. There was a light at the end of the tunnel, but they're now saying that quite a lot of their members, including those members who have been incredibly resilient throughout this, are now starting to feel really fed up. And for some of them, that's becoming an issue around low mood, anxiety, and for some of them, mental health issues. Also issues around physical health for older people, particularly those who haven't been getting out, issues around deconditioning, eating not very well, and issues around social isolation, and that potentially leading to loneliness. So neighbourhood networks are sort of trying to get their head around how they can work with their resources to support those who are most vulnerable, get those out and about and up and moving who need to. But they are also facing the additional costs of delivering in a COVID-19 pandemic, around limited space and around increased PPE. So it is a continually shifting picture, with networks continually adapting and trying to respond as best as they can to the needs of their members, and particularly over the autumn and winter months.
Thanks, Ali. And I think, yeah, that dynamic response of the neighbourhood networks is something which has really shone during the pandemic, and really made the third sector stand out as a key asset within the system, how responsive and dynamic it is to meet challenges. Damien, can I move on to you, please?
Sure. Hi, everyone. Yeah, it's Damien from Feel Good Factor and the Orion Partnership. First of all, I will have to leave a bit early today, so sorry about that. And I'll be quick as I can. I think I'm not going to rattle off the usual stuff I rattle off, because most of you have heard it all before anyway. And in terms of new things, I'm very East Leeds centric, but I do happen to know some other activities going on across the city, which I'll be sending to Karen in due course, so she's going to send them out to people, just so you've got some information there about what's available for them across the city, online and offline. I just wanted to say as well, I really appreciate this group. I find it's a very useful group for me. It's great to hear about all the different communities, especially because we don't get to meet up in real life, so to speak. You know, and just get a feel for what's going on, and everyone is very, very generous with how they share things and what they share. And I was thinking about, I want to share this with you guys, really, about the fact that we are communities of interest, and I think these last time we talked about the issues that came up, and then I just wonder if there are these top 5 communities type things that will be coming out of this, because I don't think that, for me, that doesn't fit well with what us guys are about, because I think we're talking about commonalities of issues. I feel, and I think that's great to point out commonalities of issues across different communities and how we respond to those issues with our communities, and what the solutions are, and how those solutions will be channeled through to the people that we're working with. And I just wonder, I would like to see us as solutions, offering solutions to issues rather than concentrating solutions via a sort of select top 5, top 8 communities, whatever. Because, for example, the issues that Owen said about access to libraries, well, that can go across the board, can't it? For example, meeting up outside, as Ali said, you know, I mean, that can go across the board as well. And, you know, you could say, I'll concentrate on Black men because they're 4 times more likely to die from COVID. Well, that wouldn't be fair, really, because you could talk about, if they die, what about the people they leave behind? They're the ones who suffer in a way, and that could be anyone. Or you could say the fact they die is because they're in disadvantaged communities. So actually, we should be looking at deprived communities and the people who happen to live in there, rather than just Black men, for example. So I just wonder if maybe, I don't know if these groups later on are going to be talking about that, but maybe as a group we could look at what the result of what our brilliant conversations are, and what we're going to do with those, so we can all stay we're all everyone's needs are met. Yeah, that's just what I wanted to say, really. I don't know if that's helpful or not.
No, it absolutely is, Damien. And I think one thing that we noted with this group from the start is that kind of the importance of sharing and learning as a means of bringing people together rather than looking at people in isolation. And you're right, there's a whole lot of intersectionality going on. And it's really important that we look at the issues in a way which sees that complexity, sees the overlap. And from my perspective, the sharing that we have within this group is just massively positive, and yeah, it really helps support that action-focused agenda and coming up with solutions, which again can be shared.
Hi everyone, just a very quick update from Health Watch today on behalf of a couple of colleagues of mine, we're launching a new project looking at end of life care. So we're looking to speak to people who have cared for loved ones who are either at the end of their life or have now passed away. So the best places to get information, just general information about it, would probably be on our Twitter and our social media. But if anybody here would like some more information, just send me a message, and I'll get you in touch with the right people at Healthwatch. Other than that, our surveys that we've done in collaboration with Leeds Older People Forum into older people's experiences as we approach winter are still ongoing. So if you know any service users you think might be interested in either of those projects, please do just give us a shout. Thanks everyone.
That's great, thank you, Anna. Can I move on to Sam, please?
Hi everyone. So in terms of migration and refugees and people seeking asylum, first of all, we have a project called the Migrant Access Project that works with grassroots organisations and people from very diverse backgrounds who are taking leadership in communities. That still continues every week, a virtual drop-in, so people are kept up to date with information. And at the moment, they're focusing on hate crime, as it's Hate Crime Week. The Cultural Food Hub continues, and Daisy, I'll send you an email with the contacts for the Cultural Food Hub. It's Hamara in the south, the west and the north of the city, and Give a Gift in the east of the city. They continue to operate, and you can access those organisations if needed. It's been really great that our MAP group have also linked up with those organisations to help people who really find it very difficult to access things on their own. Healthwatch, we completed your digital access update, so you'll receive that. Just a couple more things on the asylum agenda. There's a lot of complex issues that we're working through with providers, particularly now the Everyone In agenda has ended. So looking at the discontinuations, destitutions, we also have 3 hotels for initial accommodation in Leeds because there is a high number of people arriving to the UK to seek asylum. So that is a particular complex piece of work that we're working on with providers and partners. COVID-19 key messages, as you know, I work in the task group, and we try to create messages that work better for communities, and we've made YouTube videos, and I know you've all shared those. At the moment, the messages are changing more quickly than we can keep up with them. We are looking at some of the priorities. So at the moment, the 6 key messages still stand up. What we are looking at as a group is, well, since we last met, I think we had local restrictions change, self-isolating was seen as a priority, that communities might not really be understanding self-isolating. The rule of 6 as well, and now we've got tiers. We're also speaking to other local authorities in the region. I meet with them upon migration, but can we do something regionally? And perhaps through the tiers and regionally, maybe we could, you know, co-produce something that we can dip in and out of what works for our cities. But if you do put in the chat while we're on any other priorities that you're identifying around what messages people are needing help to understand. Lastly, and it relates to key messages, I'm working with Daisy and Forum Central and PIP around some of the funding work. So I'm helping with the BME, or culturally diverse communities, the bits of funding that are targeting that demographic. And so I'm working with the NET and the BME Hub and some of the other organisations around that. So helping to get resources out there and build capacity so that people who have trusted connections with people that are finding it difficult to engage with messages are able to do that. I'll stop there, and Pip's calling me, so I'll just go on mute.
Thanks, Sam. And moving on to Jen, please.
Hi, I think I work for Turning Lives Around Supported Accommodation, so we're pretty much trying to deliver as best we can. So there's a variety of different things. Some are doing more face-to-face work, some are doing more telephone work. But as others have alluded in this group, huge issue about staff morale, staff well-being, and concerns about working amongst the second wave. And so some of the anxieties that we saw earlier on the year are now presenting itself at this part of the year. So we're going to be prioritising obviously staff wellbeing and working on that. And also it's, as Sam was talking about, the changes in messaging. So we're trying to strengthen those messaging messages around social distances, particularly with the younger people, but not necessarily just with those. So again, we continue to deliver our service within a changing environment and a challenging environment.
Thanks, Jen. And change and challenge are definitely key themes related to the work. Okay, and Sophie, can I go on to you, please?
Hiya. So yeah, just all facing the same issues as everyone else, really. Space is our main problem. We did used to have 2 very large centres where we could provide some socially distanced activities, but as Sam had said, we're providing a lot of the cultural food parties all over, parcels all over the city. So that's taken up kind of both of our centres. We were running some neighbourhood network activities that were like the walking and gardening groups where they could be, again, safely social distanced, but with the rising numbers and Beeston being quite high up there on the list, we've decided to stop that now and just go back to our outreach and wellbeing calls. We've sort of had a meeting today about how we can sort of support our older members to access Zoom and things like that. So we're trying to put together a programme of activity with guest speakers from sort of different organisations to sort of give our Zooms a little bit more of an oomph over the winter months. And basically we're going to try and support our members to maybe get on and use families' devices or support the families to help their grandparents, etc., to use their laptops or their iPads. Our PAs, again, going back to what Karen had said about things like cancer screening and things, our PAs have got a massive focus now with trying to get people who have got long-term health problems or people who are in need of flu jabs or the cancer screenings to come into the doctors to get those done. And yeah, again, I think with our younger people's groups, although it's a little bit safer for them to be out and about, we obviously need to kind of keep in line with restrictions. So we're trying to source ourselves a decent sized gazebo so we can maybe do some outreach outside of our building so that people aren't actually coming into the building, so the neat young people can meet with a project worker one-to-one at a safe distance, have a hot chocolate and kind of have their employment and education advice that way. It's just, again, same as everyone, trying to have these creative ways that we can sort of safely have contact with our members. I think that's it from me. Yeah.
Great, thanks, Sophie. Yeah, so if anybody has a spare gazebo, please do get in contact with Sophie. And Andy, can we move on to you, please?
Did you say Wendy then? Yeah.
I did, yeah.
Yeah. So, I mean, advocacy is continuing. I know we're talking about rights later on. It's continuing with remote support and visits when it's safe to do so or needed. Obviously, difficulty getting into care homes where we know that there's lots of issues and lots of restrictions on people's rights. Still carrying on providing the mental health support, the health complaints advocacy, the Care Act advocacy. People aren't accessing Care Act assessments as they should be doing during this time. That's really worrying because that's the route to getting the funded support that you need. I've always talked about our autism service and the excellent work they're doing there in terms of the remote support, the toolkits, and our learning disability services. The LEAP 1 services meeting in Bubbles face-to-face. It's got a lot of extra funding, so it's doing lots of extra digital and employment work. We're seeing a big need for enabling people to access that information around healthcare services being still open, as I might have talked about on an earlier meeting. Lots of issues that we see, and we work with a really broad range of marginalised groups, and lots of housing issues, lots of themes that are coming out from advocacy at the moment. That's it. I'm keeping it short.
Thanks, Wendy. Shaq, is there anything that you would like to update on?
Yes, please. And apologies to colleagues who have missed your updates from, like Damien. I really find this meeting really useful. It's only the second time I've been, but I'm really grateful for being able to come along and listen to the work you do. So I'm going to do two updates from both from a local perspective and then from a West Yorkshire and Harrogate perspective. From a local perspective, we've got an issue around. Obviously, we know that the second wave is hitting us, but and there's also seasonal illnesses. Our sort of services are getting really, really busy. A&E is busy, as you can imagine. We've got a number of people who are in hospital with COVID, including a handful of people who are in critical care. So I think with your support, we could do with some messages reminding people to use services wisely and potentially using 111 where appropriate to do so, rather than A&E. That should only be a genuine emergency, so life or limb-threatening illnesses or injuries. I'll share something with Daisy. We've got a social media plan, so if people do have the capacity to share some message on social media, would really welcome that. And in terms of any of the work you're doing with community members, there's something around managing expectations, one around accessing services, but two, and it's really hard for me to sit here and say this. My first thing is I'm a patient before I'm an employee of the NHS. From a patient perspective, it's really hard because there's people who are obviously waiting for treatment and that have had to experience delays, and there's potentially some further delays. So we've got a really tricky message around managing expectations. So we absolutely hear and understand people are maybe waiting for things like, I'm going to use an example of knee operations. What we have to base it on is similar to what colleagues have said. There's clinical urgency, so there's a clinical judgment to be made, but also we've got the same issues around social distancing and COVID secure environments, which means, you're reducing waiting space, you're reducing the number of beds if you're talking about it from a hospital perspective, but also in community, how you operate and how many appointments you can do reduced a little bit just due to the additional PPE and safety measures in place. So all these have a knock-on effect on how many people we can see. We're working with, and that links nicely onto the next point, which is something we mentioned on the previous call, but just as a reminder, we're working with Voluntary Action Leeds, and I'm sure Iona, if she was on this call, would mention that she'd link in with all of the colleagues on this call around looking at how we can get some of those messages out into our communities and where appropriate to co-produce those messages so they land right and get that message across in a format that works with all our communities. As you can imagine, we're all struggling from a financial perspective. As you might have seen in the news, there's lots of challenges in the system, and it's well documented that Leeds City Council potentially have to make a number of job cuts. So set against that, when we co-produce messages, it's with that realistic expectation of what the art of the possible is. So anyway, that sounds like I'm painting a right rosy picture. But anyway, on a positive note, we have on the 4th of November our second Facebook Live session, and this one's going to be on cancer. So it's interesting that colleagues were talking about cancer awareness. So it's going to be a cancer session from 6 p.m. to 7:30. I'm just waiting for a colleague to finalize the social media graphics and the press release. Again, I'll send it to Daisy so Daisy can then include it in the round. Sorry, Daisy, to give you even more work.
No, that's fine, no worries.
But yeah, it's a good panel of health experts there to debunk some of the myths, as well as provide advice around some of the red flag symptoms that people need to be aware of. And then finally, we've developed a graphic and some resources around Can My Child Go to School Today? And that really helps parents understand what they should do if they think the child's got COVID, or whether or not it's another symptom of another condition, whether or not the child should go to school. We know that it's a struggle in terms of inequalities around people missing education. We've obviously got the risk of any potential circuit break lockdowns or whatever you want to call it. From a West Yorkshire and Harrogate perspective, 3 things really quickly. One, they're looking out for our neighbours campaign. What an important campaign right now. We're going to do an online reality series. Just to be clear, it's not Channel 4 or anything like that, it's just us guys. But we're looking for neighbours who would want to be part of that. So keep an eye out for the call out for that. From a West Yorkshire and Harrogate perspective, next month is Islamophobia Awareness Month. So there'll be various activities and messages going on around that. And then finally, we've spoken about how, you know, all the messages around restrictions and so on are quite negatively framed. So from a West Yorkshire and Harrogate perspective, working with a local resilience forum, we're looking at a positive messaging campaign, which talks about, you know, we understand you're at home, but there are things you can do, new hobbies and all that kind of stuff, and music that lifts you up, and tell us what music lifts you up. So from a, I suppose from a culturally diverse perspective, I've imported some of the music that goes beyond some of the examples that were shared. So I think that's it from me. Thank you very much.
But yeah, so hopefully you've all seen, as I said, this is something that everybody suggested, or sorry, some people suggested last time. It'd be good to discuss, and I think already from our conversations that we've had today, it sounds like it's a really, you know, a really important one at the moment. So it's so the question we came up with was, how can organisations strike a balance between adhering to government guidance whilst also ensuring they're providing services that people need and acknowledging their human rights? So yeah, there's different parts to that, but I think it's, you know, each part has already come up today. So yeah, we just wanted to give you the chance. Going to split you into 2 groups, so hopefully that'll make it a bit easier for everyone to have a bit of a chat and talk that through, really, whether that's examples of how you have been doing that, or whether you you know, like Sophie said, really want to have a safe space for people to meet, but you're not sure how to do it. Just kind of run through how it is for you, and sort of any ideas, and hopefully come up with some. Sadly, yeah, we can't solve it today, but yeah, hopefully a good conversation starter. So yeah, I will stop there. And
great. Hope your group was positive. We had lots of good conversations within ours. I am really conscious of the time. It'd be really good if we could just say, like, literally a couple of lines around what was said within your group, Daisy.
Yeah. So we had some good discussions about groups that sort of have been running health for all and risk assessments for those. So I think, again, this comes into the whole COVID secure spaces and conversations we've been having, Carl, but I think there's loads of learning that could be shared, but also acknowledging that it's different for everyone. Everyone has different spaces. While some buildings are suitable, others aren't. So yes, we spoke about human rights, and Wendy's obviously shared loads of useful information on the chat, but that's something that she'd be really keen to explore with us, and letting people know that their rights actually haven't changed that much due to the Corona bill, is it? And yeah, letting people know that they still have, you know, on the whole, they do have rights and can sort of speak up. So that's really interesting. And yeah, Simon sort of mentioned that while you can, you know, you can have sessions for people that they can book onto, but it's just not the same in terms of people just turning up, or, you know, being spontaneous, or that kind of thing. So obviously it's really challenging. That, you know, cost comes into that, the cost of running things when, you know, you've really not got that many people there. And what have I missed? Yeah, the huge challenge of carers and care homes, and, you know, that links into human rights as well. But Rachel had a really good idea about, you know, encouraging people to make their own decisions and assessing the risk themselves. So sort of empowering them to do that, and not, you know, obviously it has to be done on a case-by-case basis. There's not, you know, especially when it comes to people that are in care homes, or people that are really sick, that there's not just one size fits all. So yeah, I'll stop there, but it was really useful. I think it's only the beginning of a, you know, discussion. It's really complex, but hopefully it's something good to work with.
Brilliant. Thanks, Daisy.
I'll just clarify as well, just with that self-risk assessment, it was related to including sitting services and respite as well. So ones that are outside of the home, but also ones that come to the home as well. So I didn't want to override any sort of care home risk assessment.
Yeah, sorry, yeah, definitely separate, yeah.
Thanks, Rachel. Yeah, and within our group, talked a lot about, you know, the confusion, but also a lot about the tension between different parts of delivering services, whilst also managing the anxiety of staff. We talked a bit about kind of staff well-being as well. So sometimes we can forget that there is a well-being impact on staff, as well as the people that we are supporting, and that further creates further complexity with the equation. Also recognizing that when we're working with culturally diverse communities and communities with additional needs, then actually the boundaries can be more challenging. There can be, again, further complexities. We talked a lot about using assets within communities and the importance of having the voice of people with lived experience in the design of work and the design of messages which are going out. So yeah, I think it does feel like it needs to be an ongoing conversation, incredibly complex. We can't solve it all within 20 minutes, but yeah, some really positive conversations had. So next point on the agenda, and apologies for rushing through this. Daisy, have we got, will our meeting come to an end at 30:30, or will it continue?
No, it won't. And sorry, I think Wendy might have just wanted to come in. Did you, Wendy?
Yeah, sorry, I know you're really rushing. I would really like to support Forum Central to get out those messages to all the communities of interest about the Mythbusters and what people's rights still are, because they've got the best route through to people in their own communities. And it's really concerning me at the minute about people having all sorts of ideas about how the rights have changed when they haven't, and not asking for things that they need. So I wonder if that's something we could do with Forum Central to send out as an action, that can make a big difference.
Definitely, yeah.
Yeah.
Thank you. Yeah, we'll be in touch.
Great.
Yeah, no, we won't cut us off, but obviously everybody probably has to get off. So,
sure.
Yeah, Anna, did you want to go next quickly on digital inclusion?
Yeah, just extremely briefly, everyone, because we're sort of in the midst of writing the report at the moment, and I know that I think most people that have been on the call today have very, very kindly given their input to this report. Thank you so much, everyone. It's fantastic information has come through. We're aiming to publish the report at the end of this month, and everybody who has contributed will be able to look at their piece before then and just okay it and see if there's anything we want to change or add. If anybody has any images about for their organisation that they'd like us to use in the report, that'd be great to see those as well. But otherwise, yeah, thanks everyone, and yeah, watch this space.
Thanks, Anna. So next point on the agenda is just a COVID update. I've got a whole load of paperwork in front of me, and I'm going to try and prioritise the key points. Much of it you'll already know. So please do push me along if I am waffling. So current situation within Leeds. So demographics continue to show the highest number of cases in young people aged 20 to 29 years old and 10 to 19 years old, but also rising numbers in other age groups. Most cases are white British, and this proportion remains at 82% as reported before. Positive case numbers in younger females are higher than amongst younger men, which is an interesting point. Maybe where locally, Headingley and Hyde Park and Little London and Woodhouse wards have the highest numbers. And a meeting was held on Tuesday with partners and elected councillors from those areas to share the public health perspective of the current situation within those wards and establish a collective baseline understanding of activities which can be delivered. Hospital admissions are going up, but all partners are working incredibly hard to support the system-wide response, and the Nightingale Hospital is being remobilised. In terms of some of those groups, it appears within Leeds that there is more of a difference between young people and the rest of the population, the wider population, than in other areas of the country. I'm not going to speculate as to why that's the case. Just a bit of information around shielding. So Leeds is now classed as a high risk area for COVID transmission, and this means shielding at home is not necessary, but to stay at home, stay safe, follow the guidelines. So that's the line. The new 3-tier system announced includes the option for shielding advice to be reinstated in certain cases when an area is at very high risk, so level 3. The advice to shield is independently triggered by the Chief Medical Officer nationally, and that may be done at a national level or a local level in collaboration with the Director of Public Health. So that's something to bear in mind, that actually it may come in future. So within Leeds, that may affect people in the region of so 42,000 people in Leeds potentially. But there are people in that group with additional vulnerabilities who may need additional support if we go into that very high risk level, level 3. So even before shielding at home is advised, additional support will be needed. For example, advising to switch to online shopping, or help to follow the advice to reduce risk of exposure. And the number of people within that additional group subset of the 42,000 is estimated to be between 2,000 and 4,000. Just a little update on flu. So as you're probably aware, there's a massive campaign taking place at the moment, the biggest in history as far as I know. So flu vaccine is being routinely given on the NHS to all children aged 2 to 10 has been from the 31st of August. Those aged 6 months to under 65 years in clinical risk groups, pregnant women, those aged 65 years and over, those in long-stay residential care homes, carers, close contacts of immunocompromised individuals, and health and social care staff. But there is an extension this year. So people aged 50 to 64 may be able to get access to a vaccine if the supplies allow. And that also applies to households with people on the shielded patient list. And there's also potential to extend to young people in the first year of secondary school.
Sorry, Carl, sorry to interrupt you. Just in terms of the flu vaccine for health and social care staff, is there a mechanism for that? Are they just supposed to ring their doctor and say, I'm working health and social care, can I get a vaccine? Is that how it's supposed to go? Do we know?
I believe so.
Okay.
I think that's we've been I know Pip's been has received feedback that that's not been the case, so obviously people have been pushing back and saying that it's not it's not free or not accessible, but it definitely is. So I think if you if anyone has any feedback on where they've been sort of refused or been told that they can't get it for free, then that's to let us know, because we can then obviously pass that on. But I believe it's just a case of accessing it through your GP.
Brilliant, thank you.